Hello, today I'd like to talk about early pregnancy care. We often get calls from patients with questions about how they're feeling and whether or not it's normal, so I'd like to address some of those today. The first is with regards to cramping. It's perfectly normal to have menstrual-like cramping in the pelvis or a pulling sensation in the pelvis as the uterus and the ligaments that support the uterus stretch. Not normal to have a lot of pain, not normal to be doubled over with cramping. If you had something severe like that, we would definitely want you to contact your physician. With regards to bleeding in pregnancy, it's perfectly normal to have some light spotting or some light bleeding in early pregnancy, but you shouldn't be having a lot of bleeding and you should not be passing a lot of clots. If you did, we'd want to hear from you, or we'd want you to call your obstetrician. With regards to nausea in pregnancy, it's perfectly normal to feel nauseous, not just in the morning as the name morning sickness implies, but sometimes throughout the day. And we would recommend just carrying something in your bag, crackers, something of that sort, to make sure that you don't have an empty stomach, because having an empty stomach will also cause nausea. You can also buy over-the-counter motion sickness wristbands called C-bands, which fit tightly over the wrist and exert pressure on the pressure points in your wrist and help with nausea. Keep in mind they do have to fit tightly, and if they get loose, then they may not work as well, so please use them accordingly. It's normal to have breast tenderness and swelling during early pregnancy. It's also normal to not feel any symptoms at all. Many people don't feel symptoms, and each pregnancy is unique. So you may have felt symptoms if you were pregnant before. That doesn't mean you'll feel symptoms this time. Oftentimes people are concerned when they don't have symptoms because they think something is wrong. And I can assure you that we don't judge how well a pregnancy is going by how sick you feel or by the severity of your symptoms. It doesn't have anything to do with the health of the pregnancy. So if you're not feeling anything, that's perfectly okay, and just be thankful that you're feeling good. As far as lifestyle modifications, we want to make sure that you're not drinking alcohol, you're not smoking or using tobacco products, you're not using recreational drugs, and you're not drinking a lot of caffeine. We'd like you to wean off of caffeine if possible, and contact us if you have questions with regards to that. We also want to make sure that you're taking a good prenatal vitamin with folic acid. Sometimes prenatal vitamins can cause constipation, and there are prenatal vitamins that actually have built-in stool softeners to help with that if you're finding that the prenatal vitamins are too strong for you. But we definitely want you taking a good prenatal vitamin with folic acid. And lastly, with regards to medication in pregnancy, the general rule is that we don't want you to take any medications if you don't need them. And there are, however, some medications that you can take, like Tylenol, extra strength Tylenol, and Benadryl are okay. But anything other than that, we would want you to check with your physician. And you also should not be taking any of those medications with any frequency. So if you need to take it more than once or twice, you call your physician and run it past them before you take anything. We hope you're feeling well, and we wish you success on your journey.